We get started. So thank you everyone for joining us today. This is one of our spring events for the Children and Families Committee here at the University of Texas School of Social Work. I'm Dr. Catherine LaBrenz. I'm one of the co-chairs for the committee, and we're really excited today to have 4 amazing panelists with us who all work in different ways and different areas with children and families. And so the idea behind this panel was to bring some of the experts in the field to you as students, really to explore just the breadth and depth of opportunities as you graduate with your degree in social work. I know in children and families, there often are kind of more what we think of as traditional jobs, like in child welfare, child protective services, but children and families goes much beyond that. And so today we are lucky to have 4 panelists that have a wealth of experience and are going to be bringing their unique lenses to it. Before we get started with the panelists, a few housekeeping things for the attendees that joined us. Thank you so much for joining us. You are muted by default, and we will have among us panelists, if you want to mute yourself when someone else is talking, that way we try to eliminate any background noise, anything like that. If for attendees you have questions, there is a Q&A box at the bottom, and there's also the chat, so you can feel free to put questions in as we go. We will have a question and answer session at the end, and so we'll answer questions after all of the panelists have gone. So each panelist will get about 15 minutes to talk. We're hoping by about 1:30, 1:45, we should be wrapping up the panelist sessions. And then the last 15 to 20 minutes, it's really open for any attendee questions, whether it's about a specific type of work, whether it's about something that one of the panelists said. We're here to answer questions you might have. And so to answer, I see a few questions coming in. The attendees are not in the video, and you, again, you will not have the ability to unmute yourself, but you can ask questions in the chat in the Q&A. And so that everyone is aware, this session is being recorded, and that's just so that we have it in our archive. If there are students who are interested in these topics that we're not able to attend, that's something that then we'll be able to have for our viewing later on. So to get us started and kick us off, the very first panelist we have today is Mrs. Andrea Brown. I will hand it over to you and let you introduce yourself a bit and say what, who you are and what type of social work you've done.
Thank you so much, Dr. LaBrenz. I'm going to share my screen. Can you see my screen? Okay. Okay, wonderful. So my name is Andrea Brown, and I'm a licensed master social worker in Texas. I'm going to chat with you all about school-based social work that I do with children and families. Just to introduce myself, as you see here in the middle, this is me and my husband and my 2 children, Aubrielle and Bryant. I live in a suburb right outside of Dallas. I also work in Dallas County and also in Tarrant County. And so as you see, we are in nature. We love being out amongst the trees. We're not typically dressed like this, but you can find us there on the weekends. Over here on the left-hand side, you see me with Clifford, the big red dog. I work with primary age children all the way up to high school age children. Of course, Clifford was here to see some elementary students, but just a peek into my world. And then here on the right-hand side are all of the lovely folks that I get to do this work with on the well-being team. So these are our counselors. So I'm going to talk to you about our social counseling role. And I also get the opportunity to be these folks' champion and also their support person, AKA their supervisor, while still being able to support scholars, which is what we call our students. So as you see pictured here, these are a group of beautiful scholars. They attend Uplift Heights. And if you think back to when you were maybe one of their ages, what did you envision the well-being or the social support you had as you were a child? What did you wish you had? And if you are a aspiring social worker looking to step into the school setting, what kind of impact do you hope to make? what would you want to bring to these students? I am in the lovely position where I get to do that every day, and it is such a true blessing. And the conduit to which I do this is within Uplift Education. So briefly about Uplift. Uplift is a charter school network, and we span across the DFW. So a charter school is very similar to a independent school district. We still are bound by TEA and different rules and legalities, but it is slightly different in how we enroll our students. They are enrolled by a lottery system. We're not a private school. We don't cherry pick our students. You just imagine spinning a wheel, and wherever that wheel lands, that's the scholar student that gets to come into our school. So Uplift, they are here to ensure that our scholars are prepared academically, but also as lifelong learners, and that their well-being and wellness is taken into account and is also a priority so that they can positively impact our world. And so again, Uplift spans across the DFW, serving over nearly 22,000 students. And within Uplift, again, we're the largest charter school network. We focus on college and career and college readiness and academic readiness, but we also focus on well-being, the social and emotional support of the student, which is what I'm going to talk about today. So our social counselors, which is what I do in the school setting, our social counselors are our school counselors in a sense. So we hire licensed master social workers, licensed clinical social workers, LPCs, certified school counselors, and we focus on 3 areas. So exactly what we went to school to do, we get to live that out in real time. So what I mean by that is we do not do any of the academic scheduling, any of the testing coordination. We're only focused on mental health. And so we operate what's called a school-based mental health program. So you see me pictured here to the far left many years ago. We engage in individual and school counseling, and our scholars are referred to counseling based on need. So we don't have any quotas, but students can refer themselves for counseling, their parents can refer them, or school administrators or teachers and staff can refer them for counseling. Some of the top presenting concerns that we see with our scholars is just them navigating life. I mean, life can be tough. And so it could be dealing with their peers, their family at home, and then we're seeing a lot of anxiousness and depressive symptoms bubble up as well. And we also conduct or assess our scholars for suicidal ideation and make those recommended referrals to the community. Another part of our role is psychoeducation. So this is our opportunity to see all children in the school setting. So this is when we go into the classroom and we get to present a lesson. So the lesson could be on suicide prevention. We can talk about drug use prevention, building healthy relationships. And then this last picture here represents the work that we do campus-wide and within the community. So we may do programming for Red Ribbon Week. It's February, so we may push in and celebrate for Black History Month. And so that's the nature of the role, solely focused on the social and emotional support of our kiddos. So who do we serve? We serve all of our students and all of our families in different ways based on the need. So our scholars that are referred, we may meet with them for grief services. We may meet with them, a typical caseload, I would say, on campus. If we have 500 students, we may meet with 100 of those students across the span of the school year with individual counseling or group counseling. As we are meeting with our scholars, we're also connecting with the families. So we have family therapists that we staff on our campuses throughout the network to serve, so that our families also can meet with the family therapist if they need to. In addition to that, we are working with the community. So we partner with maybe the Boys and Girls Club or other resources. If scholars are struggling with food insecurity, we may partner with the food bank to get food backpacks to bring them inside of the school to give to our scholars and our families. So we are wanting to bridge the gap between accessing mental health services with the community, with our families, with the school. We want to create that wraparound service so that everybody is connected. So we do not turn anyone away. We also don't have quotas. It's really just based on the need. So it depends on what scholars and families need, and we're able to serve them and best accommodate what they need in that moment. So if you're interested in social work, I am biased because I love social work and I have a deep passion for it. And I would hope that anyone stepping into this would also share the same. I love this quote. Being able to uplift others is the biggest miracle in the world. Also a plug for Uplift Education, but really that's the work that I get to do every day. I am here to meet with the scholars and their families, listen to their needs, make sure that they feel seen and heard, but they're the authors of their own story. So I just get the opportunity to support them as they achieve their goals, and we get to work with some beautiful, amazing folks. So if you're interested, I would suggest, my biggest advice would be to seek internships within schools. I interned, I graduated from UTA with my MSW. I was able to intern in a school setting, which definitely prepared me. Volunteer at schools if you don't have the capacity to intern, and then connect with the school social worker. We're more than happy to share our experience. And then we have this vast world in social media where you can easily connect with folks. So use that as a way for you to connect with social workers if you have questions as well. And then apply. If you have graduated, I know at our schools, we are accepting applications for licensed master social workers, but I worked in the school setting with my BSW even. So, and through communities and schools. So there's a lot of opportunities out there if you are interested in it. And I think I just want to leave you with my contact information. Please, if you ever just want to ask more about Uplift, about school social work, what we do, how we work with families, how we work with children, here's my information. I am more than happy to chat with you about it. And I just really appreciate you all letting me take the time to share more about what I do and share my passion with you of working with children and families in the school setting.
Great. Thank you so much, Andrea, for that presentation and for the passion that you showed, for the work that you do in schools. I see a lot of comments from the chat about having very similar interests. So I think it is resonating with a lot of the attendees, and I really appreciate you sharing your expertise. So the next panelist that we have is Ms. Kaylee Emerson. And so Kaylee, I will turn it over to you to do a more in-depth introduction and talk about some of the social work and work with children and families specifically that you're doing.
Yeah. Hey, y'all. Okay. So again, my name is Kaylee, and I don't have a PowerPoint, so you're just going to have to stare at my face. Hope that's okay. But I am a case manager here at Community Learning Center. We are a nonprofit trade school. So what we do is we work with folks in the community to get them trained in things like welding, forklift, HVAC. If you want to become an electrician, we have bookkeeping, and we also have aerospace training. I'm a social worker, y'all. So I'll tell you in a minute how I ended up at a trade school, because I didn't expect that. But I think that goes to show like all the different areas that you can be in as a social worker. But I got my degree from Texas Women's University and Denton. I'm a family studies major. And I started off with the traditional like investigator at CPS. And then from there, moved forward into education. So I worked at the Parenting Center for 6 years. That was really fun. But there I taught like healthy relationships to couples and to teens. I also did like healthy relationships and domestic violence education and sex education in high schools. So that was the favorite part. I got to talk about sex all day, y'all, with kids. Sounds a little weird, but it was very fun. So that's like an option too, is like the educational piece. And what I do now for the trade school is, again, the case management. So my day-to-day life here, when people first come in, it's assessment. That's kind of always the first step. And most of what we do is meeting needs or seeing if people have needs that need to be met outside of like trade school, like Ms. Brown had mentioned. like food scarcity, transportation, childcare. Are you stable? Are you receiving the mental health help that you need? Because we know our students can't focus on the training if they can't get here, if they're not well fed, if their mental health is askew. So that's a lot of what we do. A lot of what we also do is connecting to resources. I can't even stress how important that is. If you're going to be a social worker, you need to know what's going on around you at all times. And it's also really nice. For example, if I have someone on my caseload who is hungry and doesn't know where to get food, I don't want to send them to the Hope Center. I want to send them to Michael Cole, who I've known for 2 years. And here's a little bit about him. And here's how I know him. And here's his direct number. So it's that warm handoff. You know, a lot of what I do is, it's so weird. It's not what I think it would be. Like, I do a lot of recruitment, and you'll find, especially if you work in a nonprofit, you're going to be doing recruiting and like being a salesman. So it may be something you're not expecting, but I can guarantee you, you're going to be doing it. Hold babies when people are testing, hold hands when people are crying. And then, you know, it's all over the place. There's a lot of paperwork. I will say 24-hour documentation. You've probably heard that a lot. You're going to keep hearing that. But alongside this like really emotional field, you also have a lot of paperwork to go with it. So I think it's just this constant balance of what we're doing. As a case manager, in every job I've been in, from like the investigative side to the education to now this, it's constant follow-up. It's constant. I feel like I'm just harassing people almost, like someone should arrest me. I call people, 14 times a day. But yeah, it's a lot of follow-up, and I have to make sure that I'm building rapport with people so that when I call people 3 months from now, they want to talk to me and they want to give me the information that I need. Because if you're working on grants, like I do a lot of the time, you have to have, hey, where are you working? Where are you living now? How much are you making? And it's invasive questions, and you have to make sure that people feel comfortable enough to answer those with you. So yeah, that's kind of my day-to-day. I think we're told to offer a bit of advice. So this is like my favorite part of this. Social work is great. I would not change it. I do recommend going beyond your undergrad. If you get your master's or your doctorate, it's going to open so many more doors for you, and financially too. You're going to want to move up. But it is fun. It really is fun. You can work with a broad range of people. At CPS, I thought I would be working with kids. And I did interview children, obviously, but mostly I worked with parents. So that was different. And then when you get bored of working with parents, you can go to somewhere else and you can work with kids. Or if you're bored with that, you can go work with adults. So that is really, really fun. And it's a lot of diversity that I think a lot of other fields don't have. Like if you're staring at a spreadsheet all day, then you're just going to be looking at that spreadsheet, and there's probably not a lot of difference in that. Prepare to work long hours. Prepare to have some PTSD and some secondary trauma. A lot of us do. I think like over 50% of us have that. And so I would say be aware of that, and always have something that's just your own hobby or something that you love, because no one wants to talk about sexual abuse at the dinner table, right? So have an outlet, have somewhere to go, whether it's a sport or a church group, or I play dominoes, y'all. I'm a real dork. I play dominoes. So just have something that you can hang on to. And I think that's kind of like all that I have for you guys. So yeah, thank you.
Great. Thank you, Kaylee, for bringing a lot of those different elements. And I'm actually curious, before we move on to our next panelist, out of the different roles that you've had, do you have one that's been your favorite?
My favorite by far was teaching the healthy relationships to the high school kids, like what that looks like and what sex should be like, not just the keep yourself wrapped up in a condom, but like healthy sex, this is what it looks like, and a healthy relationship, this is what it looks like. And how do you know when you're not in one? That was the most rewarding because the teenagers can still, I feel like can still grow so much. So yeah, thank you.
Great. Well, thank you again for giving the different kind of your journey and how you've gotten to where you are. Again, I think it's helpful to see also with the breadth, even just with one individual, you can have so many different opportunities and options because social work is such a broad field. So I really appreciate it.
Thank you.
Our third panelist that we have today is Ty Chamberlain. So I will turn it over to you and feel free to give a little bit more of an introduction as you talk about yourself and the type of social work that you do.
Good afternoon, everyone. I want to thank everyone for joining us today. My name is Ty Chamberlain. I graduated from UTA with my MSW and took my licensing exam shortly after. And so I am a licensed master social worker. My role of a social worker, I actually utilized it in two different ways. So the first way is being a C's teacher, and I'll get into what C's means in just a second, but I am a teacher. I work at Turning Point Secondary School. It is an alternative school in AISD, which is Arlington Independent School District. A little bit about Turning Point, being that it is an alternative school, it is not a school of choice. It is a school of placement, which means we see students that may get in trouble with the law or get in trouble with, at their home campus. It could be anything from fighting, bringing illegal substances to school, even bullying. It really varies. There's a broad spectrum of what you can get in trouble and get you sent to Turning Point. So that's just a brief overview of kind of some of the actions and behaviors we deal with as far as students. So my other role, I serve as the campus's behavior specialist. And as I said, I'm a visual person, so I'm going to share my screen to kind of give an overview of what C's is, how I utilize it in my role as a teacher and as a behavior specialist. And so okay. I don't think
I think it should be the green. There you go.
There we go. That's not the one. That's actually what I wanted to share next. Okay. Can everybody see that?
Yes.
Okay. Let me see. So this is on the AISD website. So I will go ahead and start reading. Okay, so C's is a service and support option on a continuum designed to meet the diverse needs of students with severe chronic behavior that adversely affects the student's educational performance, despite the use of other supplementary aids and services. The behavior is pervasive across the school environment and suggests the need for specialized supervision and individualized behavior intervention strategies. The primary focus is on positive behavior alternatives and increasing coping and social skills needed to be successful in the other special education and general education settings. So generally the C's program, I generally work with special education students, but I have the unique opportunity to also work with general education students. So my day-to-day, it varies, but I will get into that a little bit later. I just wanted to have that. Okay, the components of this support emphasize age-appropriate general education curriculum in conjunction with continuous proactive teaching of pro-social replacement behaviors and skills. C's provides an environment which allows for learning and behavior changes through a social, emotional continuum. Our focus is on proactively teaching behavior control, problem solving, decision-making, and relationship building strategies with specific social and emotional processes to replace inappropriate behaviors. The anticipated outcome of the support is that students will reintegrate into the general education setting to the maximum extent possible. In a timely manner, life management, a class taught by C's teachers, provides direct teaching, training, and reinforcement of special skills needed for social competency. Instruction to students lacking appropriate social responses occurs in varied situations and settings. Lessons and materials focus on developing the interpersonal, social, and problem-solving skills needed for social competency. So that's a brief overview of kind of what C's is. I hope that answered any questions in regard to what the program, the purpose of it, and what that looks like. So with all that being said, I like to add a clinical and therapeutic perspective. And so I have the freedom to kind of plan lessons and interventions from a clinical and therapeutic lens. So just to clarify, I don't do therapy in the classroom, I don't do therapy in the school, but I do use a therapeutic framework in the work that I do. And my why as to why I do that, I believe I want students to leave Turning Point with something of value that they can carry on into their real lives. So when we talk about coping skills, when we talk about mental health, I like to plan things to be interactive as possible. I don't know if I've already said this, I'm a very visual, hands-on type of person. So I rarely use paper. If I have to do assessments and do goal tracking, I'll use paper, but I really like to do things that are interactive, that get your brain really engaged and interested. I always say, you know, learning doesn't have to be just learning. It can be fun, it can be interactive, and it can be exciting. And so I go out of my way to plan for each student individually, and I'll just use fake names. Johnny might need a more structured, more paper type lessons. Susie might need visuals, videos, games that she can use to learn. So from student to student, it looks a lot different. And that's part of the fun of being in this unique position as a teacher, as a social worker, coming up with how can I accommodate my students and support my students and meet their needs. So it's challenging, but it's also, I feel like it brings the best out of the work that I do, because I'm always thinking of creative and great ways to help support my students. So I'm going to focus on work with children and students, and then I'll bring in the component of working with the families, their guardians. So I have an example of this is what I call a SEL tracking form. It stands for social emotional learning. It's individualized for IEP, which is their individualized, did I forget the acronym? Education plan, I'm sorry. So I just put the fake name sample student. Normally their name would go there. I put the date and the time. And so right here is all of their classes. So generally at Turning Point, you have all your core classes: English, math, science, social studies. And then my class, which is life management class, or SEAS, which again stands for social, emotional, academic success. And then I have an option for all classes. So I like to track goals weekly. I collect data every day, but I do this form once a week to keep up with tracking of the goal. And so sometimes I'll do all classes, because if they're successful in all of their classes, I'll just check that off. Let's say they're not successful with their goal in English, then I would just fill out why they weren't successful in English. And if they were successful in their other classes, then I would fill out the form for each class. So that way we have data saying Johnny was successful in math this week, Johnny wasn't successful in English and social studies. And let me get to an example of a goal. So goal number 1, and these are real goals I use. The only thing that isn't real is the name. So by the end of 30 instructional days, and I put 30 specifically because at Turning Point, you get an assignment. So let's say you get in trouble for getting to a fight with a peer. So you might come to Turning Point for 15 days, you might come for 30 days, 45 days, or 60 days. So this student, for example, they're assigned to Turning Point for 30 days. So that's why I put 30 instructional days, because that's the length of time that they'll be with us at Turning Point. To continue, so sample student will display compliant and appropriate behavior in the classroom at a minimum of 75% accuracy. So I just want to pause really quick. So I always look at the students' data from our program we use. Typically at Turning Point, we don't have to come up with data. We don't have to come up with this information. It comes from their home school. So a lot of the work is already done. What we do is come up with a goal that's realistic and that's applicable with during their time at Turning Point with us. So we don't want to put, for example, I put 75% accuracy instead of 100, because realistically, no one's going to complete their goal at 100%. It's really, I'm not gonna say it's not possible, but it's very hard, especially if you're already exhibiting some presenting problems and behavior concerns. It's gonna be really hard to set a goal at 100%. So 75% with this student is more realistic for what we've been working on, for the amount of time that we have with them. So that's how I ultimately came up with this goal. And so the answer choices, either they were, yes, they were successful, no, they weren't, or they were absent this week. And I put that because if they're absent, then obviously they're not going to be successful or unsuccessful with a goal if they're not present. So I came up with another goal, and goal number 2 would be by the end of, I had a typo, excuse me. So by the end of 15 instructional days, sample student will effectively recognize emotions and utilize designated cool-off place or utilize appropriate coping skills, at least 3 out of 5 trials. So what that would mean, being able to recognize what they're feeling. I work with a lot of students that have some behavioral issues or social emotional issues, and we spend a lot of time coming up with coping skills, coming up with, okay, what triggered you to feel this way? We want to focus on not just what you're feeling, but why you're feeling. And if we're able to tell why you're feeling that way, what are some more healthy coping strategies we can use in these moments to deal with that? And what I mean by utilizing designated cool-off place, my classroom is not in the building. We stay in a temporary or a portable. It's those buildings that you kind of see outside of the campus if you're familiar with a high school or junior high setting. So we are set outside the classroom. And I kind of like that because sometimes students get overwhelmed, they get overstimulated, or they might get aggravated with a teacher, with a student. And so we created passes that they can show their teacher, and their teacher will escort them to myself or my colleague that shares a classroom with me. And so that's what we mean by like a cool-off place. But ultimately, like I said earlier, with the SEAS program, our goal is to kind of get them reintegrated into their general education setting. So we really want to focus on those coping skills and the student being able to de-escalate on their own. Sorry about that. So the goal is to kind of create that independence to where you won't need my class anymore. So that's the goal. You'll be able to use those coping skills that we've been talking about, that we learned. So that way you'll need me less and less. Which, will I be out of a job if everyone did that? Yes, but the goal is for every student to find their independence and be successful in a social and emotional competency. Okay, so I'm gonna stop sharing my screen. There we go. So I want to talk about the component of using the family. So I communicate with the students' guardians very often. I like the process to be as collaborative as possible. It's great to do great work in the classroom setting or in a clinical setting, but as we know, as social workers, it's really about the environment, the home environment, the environment outside of the classroom. How are you going to be successful when you're not with your support staff and your therapists, your teachers, your social workers? And so I really like to communicate with guardians, caregivers about this seems to be really working. Do you mind trying some of these strategies at home? So that way, I'm going to use the name Johnny again. Johnny can see that this is bigger than just outside of here. We want you to be successful at school, but we also want you to be successful in your life outside of school. And so I've had guardians do some pop-up visits. Sometimes it doesn't go as smooth in the classroom. You know, we have some outbursts, we have some issues of anger and aggression that come to surface. And so sometimes I had recently a parent come and they said, I'm going to do a surprise visit on my child, but I don't want you to tell him. And that was the perfect day for them to do a surprise visit because we were having some behavior issues that day. And as soon as they saw their guardian come in, that behavior just went away. And then we had a conversation. We had the assistant principal, we had myself, we had the guardian, and we had the student there. And it was kind of like a treatment plan meeting. Like, we have to come up with ways for you to be able to handle your frustration and your anger. And it was a very, I like to say, restorative conversation because we were able to get to the root of some things that were going on at home that sometimes we have no idea working in our field that we can be oblivious to. And so I was glad that we had a willing, because not all guardians, as you may know, are willing or are as engaged or present, unfortunately, in their student or child's lives. But I'm thankful for the ones that are, because it takes the whole village, as that saying goes. It really does. And for the best chance of success, we all have to be on the same page. We all have to see it, maybe not from the same lens, but we all have to have the same intention, which is the social and emotional betterment of the students. And so I'm looking at my notes really quick to make sure I don't leave anything out. Oh, I do want to add, sometimes we do have students that have a formal diagnosis, maybe a mood disorder, maybe ADHD. Sometimes it's in their paperwork. Sometimes we learn that this is something they have along the way. And it's always important to document, because if you don't document, it didn't happen, as they always say in our field. So I think Ms. Emerson said earlier, lots of paperwork. I do a lot of paperwork, but it's important to document and have that data there, because if anyone ever comes back and say, well, we didn't have these issues, or how come your student's doing so well here, but when they come back to their home school, we have all these issues. And I always ask, did you look at my documentation? And did you see what works as far as coping, as far as accommodations, as far as some support? So you always want to have that as backup, in case someone kind of tries to point the finger at you saying something's off. But no, everything's there. Okay, so I'll wrap up. Lastly, advice that I would share. I had a mentor of mine say that your gut is always designed to be loyal to you. And so I always say, go with it. Don't second guess yourself. And I would say, be okay with plans changing. I thought I wanted to be in the drug and alcohol field, like a substance abuse counselor. My goals changed along the way over the years, and I learned to be okay with that. It's okay to feel like you want to go this direction and you end up in a whole different direction. I never thought I would be in education as a teacher. I knew eventually I'd be a behavior specialist, because that's a passion of mine, but I never thought being a role as a teacher would ever be in my plans. And so I'm glad that things fell into place the way they did. And I would just say, sorry, I'm just processing. Continue just to go with your gut, and that just know that you will thrive. And it's not going to be an overnight success, but the reward at the end will be worth it. And so I want to thank everyone for their time. And that's all I have for today. Thank you.
Great. Thank you so much, Ty, for sharing all of your information about the work you're doing. And I think like showing some of those specific examples, plans. I saw some questions come in that we'll get to after, but I really appreciate you showing that. And I think, what we've seen from the first three panelists is just the different experiences you can have, the different approaches you can take for social work. And so on this note, I would like to go ahead and present our final panelist of the day, it's Lisa Luna. And I will turn it over to you to give a little bit more of an introduction about yourself and some of the work that you do.
Hello, everybody. My name is Lisa Luna. I am an LMSW with the state of Texas. I work at, right now, the only maximum security state hospital in the state of Texas. However, Kerrville State Hospital is in the process of building their own maximum security forensic unit that's supposed to come online in the spring, and I will be transferring as a promotion from Vernon State Hospital to the Kerrville State Hospital, where I'm going to help them build their program. So what I do, I am the chief social worker on the social learning and rehabilitation program. North Texas State Hospital is made up of two campuses. We have a campus in Vernon that is a forensic campus, and we have a campus in Wichita Falls that's just a regular state hospital facility, for patients that don't have insurance or for whatever reason aren't able to afford private psychiatric care. They will go into one of the state hospitals, not the one in Vernon. In order to be admitted to the Vernon State Hospital, that is a forensic hospital and it is a maximum security hospital, what that means is we have a 22-foot fence around our entire campus. So we all get paid hazard duty pay because we do work with criminals. We refer to our people as patients, not as prisoners, because they typically do not have a conviction. Our population is made up of 3 types of individuals. We have patients that come here for the competency program. They have all committed a felony crime and have been found to not be competent to proceed with trial. So they're sent to our state hospital to our competency program under a 4-month commitment. So what that means is they have 4 months to have their competency restored. If they are restored to competency, they are returned to their county jail, where in most cases they undergo another competency evaluation by the court, and then they are placed on the docket to proceed with trial. Unfortunately, what happens a lot is once our patients leave here and go to the county jail, they are not treated in the same manner that they're treated here. And many times they start refusing their medication, they decompensate. When it comes time for the court to reevaluate them for competency, they have decompensated enough that they're found to be incompetent to stand trial yet again, and then they are returned to our campus. And then when they return to our campus, they will come to the social learning and rehabilitation program. Also, from the competency program, if they are unable to get competent within their 4-month commitment, they are recommitted for 12 months and sent to the social learning and rehabilitation program. So our patients tend to be more long-term, where the competency patients are only 4 months. We have some patients here that have been here 20 years and have never been able to get competent. And unfortunately for the state of Texas, if you are here under a competency commitment, we can hold you for as long as you would have been serving time for your alleged offense. So if it's say a capital murder case, you can be held here for the rest of your life if you are never found competent. So, and we do have several that have been here for many, many years. We have 4 programs on this campus, on the maximum security campus, and that is the adolescent forensic program. Those kids are usually between the ages of 11 and 18. At 18, they age out, and if they have not been found competent, then they come over to the adult campus. Those patients tend to be or have co-occurring diagnosis. They have substance use diagnosis along with the mental illness diagnosis. They are court ordered by the courts to participate in the program. If they refuse or they are unsuccessful in the program, they are returned to court and generally will go into a Texas Youth Commission facility from here. We also have, of course, the competency program, which is the biggest program that we have. Their duties primarily are restoring competency. That's all they do, is they work on competency classes and COPS D, which is the co-occurring disorder class for patients that have substance abuse issues. We have, if they're not found competent, then they can transfer out to the multiple disabilities program, which is where we place our patients that have a mental illness along with a physical disability or basically any other disability other than just mental illness. They go to the multiple disabilities program. Then we have the behavioral management treatment program. Those are our highly aggressive patients. I try to say that with a straight face, because any of these patients have a very high likelihood of being highly aggressive. The behavioral management treatment program is considered to be stimulus seeking. So these are the patients that are constantly in your face, they want to touch you, they're very aggressive. The patients on the social learning program are referred to as stimulus avoidant, which I do not agree with. Having worked on the behavioral management program during my graduate internship, and then working on the social learning program for the past 10 years, I don't think that our patients are stimulus avoidant. They are just as aggressive as the patients on the behavioral management program. A typical day in the life of a social worker on social learning. First of all, we're the biggest unit. I supervise 10 social workers and case managers. Our case managers are not social workers. They take care of a lot of the one-on-one patient issues. They take care of their trust fund. If they have a town order, anytime they have an issue they want to discuss with the social worker, it goes through the case manager first, and then the case manager informs the social worker, and then we go out on the floor to meet with them. We are responsible for doing the biopsychosocial assessment upon every patient within 7 days of them coming onto the unit. And so, as you can imagine, many of them that come straight from jail are still very psychotic. So we have to figure out how to be creative and pull information out from a patient that very likely is extremely psychotic, hallucinating, delusional, violent, just anything you can think of, they can be experiencing when they first come onto the unit. So we do their biopsychosocial assessment. We do a personal safety plan with the patient where we elicit information from them, what their triggers are, what their calming strategies are, what their symptoms are, so that we know if we're standing across the room from them, so that we are able to recognize when a person is starting to feel anxious or they're about to act out with aggression. We get that information and develop a personal safety plan with them. We are the ones that contact the families, and we maintain at a minimum monthly contact with the family members if we have consent, and provide them with updates on the treatment that that patient is receiving. Anytime that patient is restrained, we can also contact the families and let them know within 24 hours. We do, all of our social workers on this unit are completely full contact trained, which means that we can go out on the floor and restrain a patient just like a psychiatric nursing assistant can. The social workers on the other units are limited contact, so they're not likely to participate in a restraint the way we will on this unit. We do personal restraints where we just use our body, our arms, our hands, or whatever to impede aggression. Of course, we're always going to utilize our verbal skills first to try to avoid that. But if that's not working, then we do have to do a personal restraint. If the aggression continues, then we pull in a mechanical restraint chair where the patient is placed in and strapped into this mechanical restraint. They are predominantly treated with antipsychotic medication, anti-anxiety, antidepressants, so that we can get them stabilized enough that they can learn and retain competency restoration information. And then also, as we continue to work on restoring them to competency, every patient has the right, according to the administrative code in Texas, to be treated in the least restrictive environment available to them. Well, this is a maximum security hospital. So every 6 months, they are taken in front of a statewide dangerous review board. And the social workers and the psychologists write the dangerous review reports on each patient and present it to the statewide board. with the patient sitting next to us. So we'll go in and we'll cover how their treatment's doing. We have to do a synopsis of what their alleged offense was and any restraints that they've had over the past 6 months. We have to share that with the statewide board and make a recommendation on whether we feel this person is no longer manifestly dangerous and can continue their treatment on a less restrictive hospital, or if they are still manifestly dangerous and have to continue their treatment at this maximum security hospital. And there is a difference with our patients. We are never saying that they are no longer dangerous. We are saying that they are no longer manifestly dangerous. And what that means is they are able to control their aggression for the most part with psychiatric interventions, whether it's medication, whether it's calming strategies, whatever interventions are set into their person-centered recovery plans. We do reviews of these person-centered recovery plans every 30 days. At that time, we also review their personal safety plans and any contact we've had with family members, and allow the patient to provide their input on what goals they want to set, where they feel they're at in meeting the previous goals, and covering any concerns that they may have that have developed in the past 30 days. So we stay very busy. We have several high-profile patients that come here. We have multiple patients that are diagnosed with antisocial personality disorder. So those are always very interesting to work with and watch how they interact with other patients. So it's a very interesting job. This side of social work, working for the state, is not the best paying job, but I would venture to say, having been in the social work field for 25 years, that it probably gives the best experience, life experience, and social work experience that I have ever worked in.
Great. Thank you so much, Lisa, for sharing all of your experiences. And I'm just curious, before we go to our general question and answer, what advice would you have for students that are interested in this type of work compared to maybe other types of social work?
I would recommend that this not be the first job for a social worker. I think it's very helpful to have a little bit of life experience in your bag of tools, because this population can be extremely manipulative, and because we do have several patients that are antisocial personality disorder, and they can feed off of new people. That has been a big problem, not just for social workers, but for our psychiatric nursing assistants, for anybody that's coming in that doesn't have a lot of the life experience, so that they recognize when they're being manipulated. So I would definitely make that as a recommendation.
Okay, great. Thank you for that, Lisa. And I'm gonna remind our attendees. I see we have some questions we have some questions already in the Q&A box. But if you do have any other questions, please feel free at this point in time to go ahead and put them in. And this is the time to open it up. Again, you can put them in the Q&A box. You can put them in the chat. And I'll start going through to see what our panelists have to say. So I think the first question that I see in here was one that Stacy asked, and she was asking if there were any certifications that MSW or BSW students can work toward while gaining their degrees. And I believe that this was asked during the presentations, I think Ty and Andrea's on school social work. So if there's anything maybe related to, like, if you have certifications specific to school or anything else that social work students could work on. Okay, and I think you just clarified, for school social work specifically, do you have to have, for example, a teaching certification?
That's a really great question. So for Uplift, you do not have to have a teaching certification. I think I also saw some comments about you were coming from other fields of interest, or maybe you concentrated on aging or some other field that wasn't children and families. That's totally welcomed, especially in social work. It's so diverse, and you get to bring those skills that you have in other areas to your work with children and families. So for school social work, no. For school counseling in a traditional ISD, they will ask that you teach for 2 years, but that is not the case for school social work at Uplift, and from what I know in other school districts for school social workers, but it could be different for, I'll let Ty respond.
I think you stated it correctly, Ms. Brown. That's typically the requirements. Now, I will say, school social worker, no, you don't need a teaching certificate nor years of teaching, but if you're wanting to pursue, kind of like similar to my role as a C's teacher, they do require that you have a teaching certificate. It doesn't say how many years, but they do require you to have a certificate. And I think I'll just go ahead and answer this question. I think someone asked, do you have to be certified to be able to go for that? And yes, but you can get alternatively certified. You don't have to go to school and get a teaching certification, but I can answer that question a little bit more in detail when we get to that one.
Okay, great. I think if you want to go ahead and answer it now, that way we can go to the other ones, the other topics I think that aren't quite as related.
Okay, so I knew I wanted to work in schools, and at the time, my passion wasn't to be a school social worker per se, because at this campus, it was very limited as far as the clinical, the mental health part of social work that I really was passionate about. Typically here, our social worker will provide resources. It's more case management, it's more providing resources, and I won't say there's not the clinical mental health part of it in there. It's just it's hard to get to that part when you have to kind of take care of the basic needs, of the student, and as far as resources go. So when I got offered the opportunity of this position, even though it's teaching, as I stated earlier, it's very much a blend of a lot of things, kind of some of what a counselor does, some of what a social worker does, but just in a teaching role, in a behavior specialist role. And so I went through a program called ECAP, so ECAP. I don't know if I remember the acronym. If you Google ECAP, it should come up. So I went through them. It doesn't take long to get, you just put in the application, they'll look at your transcripts. Because they saw that I had my master's in social work, they kind of gave me the green light to go ahead and start with the program right away. It's really, communication is great. I didn't have any issues. It's a very smooth process. By this May or June, I should be completely done. So technically they call it, not an intern, I forgot what they call it. You're a certified teacher, but you're kind of under supervision, for lack of a better word. And so once you get your year, your not a whole year, but your school year under supervision, then you will be certified to teach. And a lot of social workers, I would say, if you can take the advantage of getting a teacher certification, and I want to say they'll take it out of your teacher paycheck every month if you do a payment plan. So it's about $300 a month. It's an investment, but it's one that's been worth it because it gives me the opportunity to look at things from a teaching lens and understanding what is it like in the classroom in that environment, and blending that with my social work perspective. And I think I don't want to teach long-term, but I am allowing it to help me in my profession. And I'm excited to see where it takes me when I do move on to something more clinical, because I am working on my LCSW to get my clinical license. And so I think I'll have a unique perspective as far as what I've gained as a teacher. And so if that's something you're interested in, I can leave my email in the chat so that way people can email me more about that. I don't want to take too much time, but I'll be happy to answer more questions if anyone's interested in kind of how I got to that and any suggestions or any more advice I can give.
Great, thank you for that. And yeah, I think we actually had a question come through earlier about contact information. And so I know Ms. Simpkins from the School of Social Work Communications team had said that I would have the option to send an email to everyone who registered later. So that way you all can feel free to leave it in the chat, but that can be a way also to follow up after to everyone who attended today's. And I think for the certification, just to finish on this thread, I think Kaylee, you had answered in the chat because I think someone had asked during your presentation as well when you were teaching for sex education. Was there any training specific that you had before doing that?
Yeah, so I did family wellness, which is a training that comes out of California. Lovely. And that was for the relationship, primarily the relationship education, the healthy education. And then for the youth specifically, it was Love Notes, which is through the Dibble or Dribble. Oh my gosh, that sounds Dibble Institute, but it's Love Notes. So yeah, those are trainings you can do online or in person. They do both.
Great, thank you. All right, the next question that was asked was specific to Ty and the alternative school that you work at. If you do any sort of follow-up or continue to work with children after they've left that school?
That's a great question. So at Turning Point, we have two transition liaisons. And so they're the ones that will go to their home campus, kind of have follow up with them, which is an important aspect as far as support, because like I said, we do all this great work here and then you go back to your home school or your home environment and it's kind of, well, what's different around me? Who's going to help me, to maintain these goals? And so they're part of our team that does do that. So if I don't contact with them, each campus in AISD has a CEAS teacher similar to myself. So that's always a point of contact that I have. And I do reach out to their teachers to kind of get updates. They have my office number if they need to reach out. So far, none of my students have returned to Turning Point. Let me knock on wood because that could change. But so far, so good. They haven't returned, but I do. The work I do with students, I take it very personal. So their personal growth and development after working with me, I'm invested in it as well. And so I don't say I'll reach out weekly, but I do over time. I was like, hey, how's so-and-so doing? And I'll get an update. And sometimes I'll go to the home campus myself and I'll try to call in advance to make sure they're there. So that way I don't waste gas going to their school. But I do try to, when I can, I do try to keep up with them and stay updated with their progress. It's just, I don't have to do that, but it's personally something I do like to do if I'm able to.
Okay, great. Thank you for that. The next question that came in through the Q&A is for Lisa. And so Monasha asked that when you mentioned restraining a person and there's some sort of training, do you have like a hands-on component of that to be able to pass before you actually are certified or are able to do that?
Yes, ma'am. As part of our new employee orientation, everybody goes through TIPS training, which is the treatment and intervention psychiatric services, or I'm not real clear on what it stands for, but we all go through. There are two components of TIPS, and those people that are considered light duty or limited contact, they only go through one component. All of our social workers and case managers on this unit go through both components, and where it's an all-day training. You have to go through and show how to do correctly the different restraints, and then pass the test at the end in order to be certified. And we have to go through certification every year, every 12 months.
Okay, thank you.
Yes, ma'am.
And there's actually one other question for you as well from one of our students, that they are interested in hospital social work, but given some of your advice, especially about your current setting, they're also interested in school social work. And for example, where you are, could it be a natural transition from school social work to hospital social work? Is that a transition you've seen other social workers make?
Actually, I've seen it go the opposite. People will start out working at the hospital and then move into school social work rather than, is that what you asked?
Yes.
Okay.
Yeah, I think it's this idea of transitioning from different fields in social work.
Yeah, basically here, your basic social work, BSW coursework would certainly be applicable here. And we do have offer internship programs. So we've had many social workers that will come and do their internship here and then stay after they graduate and then just move up through. I did my graduate internship here while I was working here. So that's a huge benefit to work here and be able to do your internship here just on a different unit so that you're working with a different population.
Okay, thank you for that.
Dr. LaBrenz, can I add to that real quick?
Sure.
Okay. So for those that are interested, maybe the hospital setting, I know that Millwood Hospital is often used as an internship placement. And I happen to work there PRN on the weekends. And so it's interesting working there and then working in a school setting. I hope I can kind of answer that question as far as the transition. There I'm in a different mode a little bit. I work as a program therapist at Millwood. So I do process group. And so how are we feeling today? We assess for suicidal ideation, homicidal ideation, and then we do a skills group. So that part is kind of similar to what I do here as far as today's topic. We're going to talk about what triggers our anger today, or it can look like we're just going to do some meditation with music and kind of do some mindfulness training. So it really differs depending on the group dynamics. But I would say if you're interested to see what is it like in a more, because it is a mental health hospital, so it may not be the same type of hospital that Miss Luna may work at, or it may be similar. I'm not sure, but I would maybe look into that when it's time to do internships and do field. Maybe that would be a potential option for those interested in that field.
Okay, thank you for sharing that, Ty. And yeah, I think, hearing again, just the journeys that you all have had in the different types of social work, really using the internship experience to explore different types and different areas of work is a great suggestion. All right, we have a few more questions that came in. One is specific for Andrea, asking if in schools you have to be licensed. And I guess that could also be, Kaylee, you've worked in schools, Ty, you've worked in schools.
Yes, you have to be a licensed master social worker or a licensed clinical social worker. So if you look on applications, they'll probably say LMSW preferred or LCSW preferred, but typically you do have to have a license. For Uplift, you'd have to have a master's level license.
Okay. And I don't know if any of the other panelists had anything to add to that answer. Okay. The next one is on a semi-similar vein with school social work. So they said that, they heard about assessment, individual counseling or sessions, and they were asking about whether any of you do group counseling as well within school social work.
Yes. So group counseling is very powerful. I think one of the main group counseling services that we've been offering lately is around grief. So grief groups, there's been a lot of grief with the pandemic and just in general. So typically we will host those sessions and we will send home a permission slip to families for their parents to complete that they would like their child to participate in group. So yes, that is something that we offer in conjunction with individual counseling services.
Great. I think the very last question we have right now, unless anyone else wants to drop any final questions in the chat, and I think this is a good question because it can be for any of you, is just if there's any recommendations you all have on books that can help prepare students to work with children and families. Any recommendations for books? It's fine
Yeah,
if you don't have them either.
I have one, it's a children's book, but the new, it's Change Sings. It's a new book by Amanda Gorman. I love it. I love it for kids. I love it for adults. It's so uplifting. I would recommend that to anybody.
Okay, great. And that might be something, if any of the panelists have thoughts later on, you can feel free to reach out, send an email and I can distribute it to the emails of people who registered for today's session.
Yes, I definitely have an inventory of books. It's just whenever someone asks, I cannot rattle them off the top of my head. But I think one is called The Whole Brain Child. Also, I strongly recommend, I think it's Beyond Burnout. I think for ourselves as social workers working in this field, I talked about a lot of the fun and awesome things you can do as a social worker, but there are some days that are tough. So I definitely would make sure that you are keeping up with your own self-care and wellness. But I'll send an inventory of the books that I use with scholars K through 12, and then hopefully that can get to you all by Dr. LaBrenz.
Oh, y'all, sorry. Also, anything by Brene Brown, just read it.
Right, great. And I actually see a few in the chat coming through as well. The AT Parenting Survival Podcast by Natasha Daniels. And I see some comments seconding your, Kaylee, your recommendation for Brene Brown. Right, we actually have one final question that came through asking if students are able to intern in school settings without being licensed. Yes, and
Yes, being able to intern without your license, absolutely, because that's what you need to do before you step into getting your license. Yes, so we host interns, so if anyone is interested in that, please don't hesitate to reach out to me.
Great, thank you. And there's one more question that came through asking about the difference between working in a school setting versus in a hospital setting, and if you can work while preparing for your license if you're not licensed. So I know, Andrea, you had talked a little bit about the licensing in schools, that it sounds like most of the jobs are going to require a license. Lisa, for the hospitals, are there also requirements on licensing to be able to work there?
Yes, ma'am. In order to be, of course, the state of Texas requires that you have a license in order to refer to yourself as a social worker. We do have a program in place now where we will hire you and give you 1 year to obtain your license while you work here. And to be honest, it has not worked out very well because two of my social workers, both master's level, have left our employment because one of them just did not take the exam. The other one could not pass the exam. So at the end of the year, both of them had to terminate their employment here.
Okay, thank you for mentioning that. So I from the other hospitals I'm familiar with in the area, I think most do usually require a license, but for internships, that's a good way to get practice.
Oh, definitely use your internships to figure out which field you want to work in. That's a wonderful tool.
Great. Well, thank you again so much. I think that is the end of the questions. So I would really like to give a round of applause to the 4 panelists that we had. I really appreciate you all sharing your expertise and just the wealth of knowledge and the perspectives that you bring to the work you do. And thank you to the attendees as well for joining us, for asking such great questions. And as I mentioned, for follow-up, I'll be sending out some of the contact information. And then if anyone has any follow-up questions, whether it's panelists, whether it's attendees, my email will be on there as well. So thank you so much again for joining us. And I really appreciate all of your time.
My pleasure.